I think slowly this year we're learning a little bit more about the business of medicine and insurance and whatnot. And then fortunately for us, there's a lot of good resources here at the hospital to get patients plugged into. So when you do encounter that as a problem, you know right away who to refer them to and what programs they may or may not be eligible for. And fortunately for us, once we get them attached to a social worker, the social worker, really facilitates most of that, and we can kind of stay on the side of doing the medicine part. I don't know what the official stance should be, but when I'm in clinic, I actually rarely know the patient's insurance status. I usually just order whatever I feel like needs to be ordered, or I prescribe whatever I feel like needs to be prescribed. And then it's usually after the fact, someone will, a nurse or a social worker, come to me and be like, these things that you want to do aren't covered, and you need to be a little more creative or a little more artistic about how you sort of get the test done that you want to get done. Do you really need this scan, or would something else suffice that would be covered by whatever program or whatever limited insurance the patient has.
Is it an expensive medicine?
¿Qué remedio caro?
It's $70.
The
prescription was 100 and whatever, and we didn't have insurance, but we bought it over the counter. It was Prilosec is what we bought.
Prilosec?
Mm-hmm.
Okay. What I might do is I'll probably use a similar medicine, but one that we can, Walmart has some affordable medicine programs, and a lot of the medicines do the same thing,
right.
The cheap ones versus the expensive ones. And so I'd much rather us use a cheaper one, of course. There's no reason to spend all that money when we can do it more cheaply.
Right.
So let's try the cheaper one.
Okay.
Let's make sure it works.
Okay.
If you're having any problems or anything seems to change, you can just give us a call.
Absolutely.
And we can change the prescription around.
We see it a little bit in med school. We're at least alerted to the fact that affording medicines, affording health care, people getting less than standard health care because of their socioeconomic status. We're definitely made aware of that as medical students. I don't think as a medical student you really become aware of what programs or what opportunities are out there for people. We're getting a better sense of that now. And even in the clinic, what we try to do a lot of times is prescribe medicines that we either know are on certain affordable medicine programs at CVS or Walmart. So we try and tailor some of our treatment to those lists.